Good morning. So why, when we know so much, do we do so little in preventing and overcoming early childhood adversity like child maltreatment? Provocative title, yes. So in the next 5 minutes or so, I'm hoping to provide a brief overview about what we do know in the science related to early adversity like child maltreatment and lifelong health and lifelong potential, health, life potential, other outcomes. And then shift the focus a little to the critical importance of prevention. And then I think that'll set a nice stage for our other two speakers Nadine Burke-Harris, who will share the critical importance of the medical home in promoting resilience and overcoming adversity, and certainly Larry Edelman, who will broaden our focus to really talk about the critical importance of changing the national dialogue around early childhood and the future of our nation. So I'd like to begin by just providing a brief overview of the Adverse Childhood Experiences Study. The original Adverse Childhood Experiences Study was really a collaboration between the Centers for Disease Control and Prevention and Kaiser Permanente, a large HMO out of San Diego, California. And they basically asked adults who were coming in for physical exams, routine medical visits, about experiences that they may have had or may have experienced under the age of 18. And here you can see the particular experiences that were assessed. So by no means is this the entire universe of early adversity that a child may experience, just 10 indicators of things that might be going on in the home. So indicators of abuse and neglect, and then other indicators of family challenges like household mental illness or household substance abuse. And then they compile an ACE score, which is a really simplistic basic count or sum of the various categories of experiences that the participants may have experienced under the age of 18. So again, a sum where 1 is 1 experience, 2 or 2 experiences. It doesn't get into the severity of these experiences, how long in childhood they experienced these experiences, and other dimensions that we know from long scan longitudinal studies of child abuse and neglect data really matter in predicting outcomes. So it's a more simplistic view of just what might have happened. And maybe not surprisingly to the many of us in this room today and virtually attending this conference, the ACE score, even among this insured, mostly higher socioeconomic status, mostly white, 17,000 participants, at least half or more than half had at least one ACE. And in fact, if you had one ACE, you were 84% more likely to have subsequent indicators of adversity. It's not just that the prevalence was high, it was also that it had stark associations with a whole host of outcomes in adulthood. So there's been over 45 empirically tested associations between early adversity, ACE score, and lifelong health outcomes. So here you can see some chronic diseases like cardiovascular disease and diabetes, subsequent violence or victimization, perpetration experiences, substance use, mental and physical health outcomes. And in all of these 40+ outcomes that have been investigated, you see this same graded dose-response effect. As your ACE score increases, so too does your risk for a whole host of problems. This is not just seen using these ACE data. In fact, many states, up to 22 states that we know of, have administered the ACE module on their behavioral risk factor surveys. They find similar prevalence, similar relationship patterns. Long scan data, similar. NSCAW, the National Survey of Child and Adolescent Wellbeing, NATSCAV, the National Survey of Children's Exposure to Violence. No matter the data source, we're seeing this consistent pattern where the more adversity you experience, the more likely you are to have poor health and other outcomes. In fact, we also know from Brown and colleagues that there's a 19-year difference in life expectancy between people with low versus high ACEs. 19 years. That's a far greater life expectancy inequity than we see in most any illness, injury, or geographic comparison. And for some, it's not just that early adversity has an impact across the life course. It's that for many, early adversity starts in childhood and continues across the life course. And then this, of course, has a compounding and cumulative impact. And we also know that certain experiences, like violence and other adversity, can really compromise the way the brain develops. We know that excessive, repeated toxic stress can impair cell growth, it can interfere with the formation of healthy neural circuits, and it can really contribute to premature aging of the body. Some frightening sort of epigenetic work shows that it's not just changes in the brain architecture or brain development, but really how our biology expresses itself can also be impacted by early adversity. So I'm not a physician, I'm not going to get into the particulars of this, but basically telomeres are those little red parts at the end of the DNA strand, and we know that they're shortened with each cellular division and can contribute to aging. And there's some real provocative research now out of Terry Moffitt's group and others that are really seeing that early adversity can cause advanced erosion of these telomeres, which means that children that experience early adversity are at increased risk for decreased lifespan and earlier acquisition of disease. So why are we all really here today at this conference, at this plenary session, virtually attending this conference? Really to find out what we can do. And so certainly CDC, our role is sort of this public health model of violence prevention where we're really interested in stopping violence before it occurs and really stemming the flow of children entering the child welfare and other juvenile justice systems and reducing violent injuries and deaths. But from this slide, you can see that we all have a role to play. It's not an either or, it's a both and this is all of our missions to really prevent violence and promote health and well-being for all our children and families. The way CDC envisions this is our vision for childhood, is assuring safe, stable, nurturing relationships and environments for all children. Historically, we've really done a lot of work on the relationship component of this, but we're increasingly interested and realize that relationships really develop within a context and an environmental, socio-political, community context. And so we need our work to continue to increase in focus on health and equities and the promotion of health for everyone's children, not just my children. My children will do better if everyone's children are doing better. And so this is just a simple graphic to show that individuals are really nested within relationships and communities and societies in which they reside. So it's really critical that prevention strategies include a continuum of activities that address multiple levels of influence. And this is not done alone. This is with partnerships, not just our usual suspect partnerships, non-traditional partnerships too. We really need to engage key stakeholders at every level of the social ecology to really make the greatest impact for our children and for our nation. And so CDC is currently funding 5 state public health departments to implement Essentials for Childhood. Essentials really creates a framework for how to use child maltreatment, how to address child maltreatment rather, by raising awareness and commitment to the issues and to the science that we've reviewed today, to use data to inform prevention and other action, and really to create the context that will support safe, stable, nurturing relationships and environments through norms change and programs and policies. So I hope that's whet your appetite a little bit for what's to come, and we'll be really interested in the conversation that this sparks afterwards. Thank you.